Me about the use of alcohol in pregnancy and how that has changed over time. Now, one of the things that we need to understand is that traditionally, women in their first pregnancies, even if they haven't been drinking, what happens is after childbirth, in many cultures in India, they're actually given a little alcohol to ward off what is called sani. So what happens is that the woman starts in childbirth, and therefore by the next pregnancy, she's already drinking a large amounts of alcohol, very often in a dependent fashion, and that affects subsequent pregnancies, both in terms of conception, in terms of what happens to the child after birth, and so on. The other pattern that we're noticing is that more and more young women, particularly in urban cities, are tending to drink. So the moment they drink, when they're, let's say, in their early 20s and so on, subsequently, when they begin their reproductive life, it has an impact on pregnancy and childbirth. So these are the two major contexts that we're seeing a change in use of alcohol as far as pregnant women are concerned. The next question you asked me is about the use of benzodiazepines.
Yes.
One of the things we noticed is that when we did a mall study, we looked at people attending malls who are otherwise very normal and found that one of the major drugs they are using without proper medical prescription are benzodiazepines. So apart from, let's say, alcohol, the other medication that a lot of young women use is benzodiazepines, diazepam, alprazolam, lorazepam, nitrazepam, and so on. And very often it's in the context of reducing anxiety, improving sleep, dealing with tensions of interpersonal relationships, and so on. So it starts off like that, and benzodiazepines are habituating, and then the person gets on to becoming dependent on it. And again, once they get into the reproductive age group, there are effects both for the woman, as for the mother, as well as for the unborn child, and subsequent problems for the child after it's born as well.